And joining us once again this morning is Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division, here to give us more and the latest updates about the coronavirus as we continue to battle this pandemic. Dr. Kothary, thanks so much for joining us.
Oh, once again, thanks for having me, Alex.
I want to talk about that model that we just showed just a moment ago. This is a new model that Kern County public health officials gave us yesterday and kind of explained what this means. Here's a look for our viewers at home. And I want people to primarily look at the red line at the left hand of your screen. And you can see where the total hospital or ICU number cases are right there. So very consistent to what the projections show. And as we look at the projections, it seems as though we could be in trouble in about 6 weeks as we see an increase in ICU cases. As you look at this projection, Dr. Kothary, are you concerned?
You know, you're always a little concerned when you get statistics like this. But I will tell you, we are pretty comfortable at this point. We have started our conversations with all of our hospitals again in Kern County to make sure that, you know, all of us have suitable amounts of beds. And if one hospital gets overloaded, we can transfer patients to other hospitals. So we are actively, progressively looking forward for new plans, new contingency plans, if you will, to be sure that we do not have a pandemic on our hands that we cannot handle.
We should note that they were specifically talking about the concern with ICU beds, not necessarily general hospitalization, hospital beds. But going back to hospitalizations in ICU cases, is an ICU patient in intensive care for longer compared to other scenarios, maybe some similar to the flu and other diseases or other issues?
Yes. What we've seen on average is our COVID patients are on a ventilator. If they end up on a ventilator, are on for about 3 to 4 weeks before they can come off. And that's very, very common across the country. So yes, they do tie up beds a lot longer than the average patient would.
What is the concern for hospitals as you can make more beds? We've heard that from different hospitals. We've heard that from public health, that there is the plan in place to have more beds available for people. Is there a concern, though, for staff?
And that's always the biggest concern, is our ICU staff. But we have other staff in different departments, like our operating room staff, our anesthesiology staff. They can function as ICU nurses as well. We have what's called RNFAs, that are nurse anesthetists, that can function as ICU staff. We also have planned, we were talking about ventilator shortages a while ago. We have enough ventilators in our company, Dignity Health, that we can share across hospitals. So I think, in terms of ICU beds, I think we'll be okay. We can use regular beds and convert them into ICU beds as well.
One of the things that we've heard from local health officials is, they really reiterated yesterday, talking about the guidelines set forth by federal health officials, talking about washing your hands for at least 20 seconds, wearing a mask when you're out in public and cannot social distance, and practicing social distancing in general. When you go out and about in the community, what are you seeing? Are you seeing people practicing those and following those guidelines, or are you seeing people start to become complacent and be a little more relaxed with those guidelines?
When we first opened up into phase 2, I think we saw a lot more people wearing masks, a lot more people social distancing, and I think as time moves on, I think people are becoming more lax. I see restaurants more packed. Bars are opening up and starting to get packed as well. So I believe that's why this pandemic is holding on, and that's why you see our numbers climbing as well.
The reason why I asked that question is because we also heard from public health talking about that Kern County could see our peak for coronavirus in February, which means that we are still several months away before we even start to see the decline in all of this. So as you hear all of this, as you start to see, you look at the projections and you see how people are responding to the coronavirus as it continues to be a threat, are you concerned about the future as we get closer to the fall and winter, even though it's still several months away?
Absolutely. And, the other thing that's going to complicate things, which we've always talked about and a lot of people have talked about, is the the flu virus. So you'll get the coronavirus and the flu virus, which the flu virus does a lot of havoc to our society as well. So by all means, I think we're all concerned, but we are preparing for that.
If you could look into the future, and I know this is very difficult to do, but if you could look into the future and see where we could be a year from now, so June 2021, what is your projection? What is your forecast, if you will, in how things will look? Will we return to normalcy a year from now? Do you think it's going to take that long?
Yes, and one of the things that will cause us to get to that level is a vaccine. I know a lot of people have talked about getting the vaccine this year. I don't think one comes this year. I think one comes next year. And once that vaccine comes, I think you'll see this virus get under control very fast.
Really quick, because we're running low on time, but I have to ask you really quick, what is the biggest concern that you have right now, and what is the glimmer of hope that you have right now as we deal with this?
No, we are seeing a surge in cases currently. Our hospitals are having a higher number of cases. But what we've also found is the comfort level of the nurses and doctors in treating these patients, and also that these patients aren't as sick as the first round of patients. So things are looking better. We are more prepared. The patients aren't as sick. You know, this virus will linger around for another month or two and then kind of die down for a little bit, and then we'll have our second surge, which everyone has predicted.
We get this question a lot from people, and it is it safe to go to the hospital or the doctor's office for an elective procedure? You've talked about this before, but can you reiterate your opinion on that?
Absolutely, 100%. You know, and I'll tell you, we have several safeguards in place at both the hospital and the office level. You know, not only are we safeguarding you from our staff, but we're safeguarding our staff from the general public as well, because as you well know, there's some asymptomatic carriers. So we've got multiple things in place. Everyone gets the max PPE. Everyone gets screened. We're testing every single pre-op patient now. So anyone that has any kind of elective surgery gets a test. So we are taking multiple steps and to make sure that everyone is safe when they come to either the hospital or our offices.
All right, Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division, thanks so much for joining us, and we will see you back here on Thursday morning at 6:30.
Perfect. Thank you so much, Alex.